Segment of
Hi
dysmenorrhea.
guys, it's Naswindi here again. So in my last video, I was like, I'm going to tell you people how dysmenorrhea could lead to surgery. But before we will go there, that is a part two of the dysmenorrhea. Before we go there, I would like to lecture you all on the treatment for primary dysmenorrhea and the treatment for secondary dysmenorrhea. I'll try to make this video very concise and simplified. You understand? So try to listen and gain some knowledge from this video. Like I said in my last video, that this primary dysmenorrhea is not caused by any underlying disease condition. It just increase in the prostaglandin level that leads to the contraction of the uterine walls. So these are just the cause of this prostaglandin. So those people that have high prostaglandin level, like I said in my last video. So if you've not watched my last video, go and watch my last video so you understand what I'm about to say in the second one. So this is the part two of the video. And so let's go down to the treatment for this primary dysmenorrhea. We have the treatment could be pathological, could be pharmacological or non-pharmacological. Then other ones is alternative treatment. Now, this pharmacological treatment is, as we all know, pharmacology is use of medication like these NSAIDs. Like I said in my last video, I said use of NSAIDs like ibuprofen with the doctor's prescription. Those ones are the pharmacological part of it. Why for the non-pharmacological part? I'll say that this non-pharmacological part is mostly like all these home remedies, like the use of heat compress, like warm compress at the lower part of your abdomen, the use of it. Then second non-pharmacological part of this treatment of this primary dysmenorrhea, you can use exercise. Yeah, some of us don't know what exercise do for us. So if you're a lady and you're having this strong menstrual cycle, you can actually manage yourself, at least treat it with exercise, yoga, mostly yoga exercise. So it's very, very good. So the third one is use of these supplements like the omega-3 fatty acid, the vitamin B1. So all these things would also help for primary dysmenorrhea. Then the last one now for this non-pharmacological part is the dietary diet, the food that you take in. Like I said, this non-pharmacological part is just like home remedies. So like the food that we take in this the food that we take in, that's the last one now. Our diets. So what kind of food do we eat? So if you know that you're having this dysmenorrhea, that's a painful menstruation, you will have to reduce fatty foods, and take more of fibers. Take more food that contains fibers. So these are for the primary treatment of dysmenorrhea. Like I said, I've talked about the medication, I've talked about the home remedies. So let's go over to the secondary part of this treatment of this dysmenorrhea, treatment of the secondary dysmenorrhea now. So in this part, that's where I'll mention the surgery, or how dysmenorrhea could lead to surgery, painful menstruation could lead to surgery. So if you've not watched my last video, try and go back to it because it will help you to understand what I'm about to say here. So, like I said in my last video, that this secondary dysmenorrhea is caused by a disease condition. It's caused by a disease condition. Like for those people that have fibroid, they normally go for myomectomy surgery. So maybe fibroid could increase or could cause painful menstrual cycle, which is why some people neglect it. They don't know. They think that it's just normal thing. I normally have painful menstrual cycle. No, fibroid normally cause painful menstrual cycle. So it's good for you to at least go to know what causes you won't, at least go for check-up to know if your own is caused by painful menstruation, to know if it's caused by as a result of underlying disease condition. For hysterectomy, those people that also have endometriosis, they normally go for laparoscopy. So all these things are the surgical procedure they undergo. At least after the surgical procedure, it helps to reduce this painful menstruation that we know as dysmenorrhea. So that is all for dysmenorrhea. If you have any question, try to go in the comment section. Ask your question. If you're confused on all this name I mentioned, ask your question, and sure, I will do a video on that. Trust me, I will do a video on that to clear the air. Thank you so much, and keep following A Talk with Naswindi. Bye.